As you breathe in, air travels down the trachea and into the lungs. The right lung is slightly larger than the left lung and has 3 lobes. The left lung is divided into 2 lobes and a small section called the lingula. At the point of entry to the lungs, the trachea branches to become the right and left main stem bronchi. Traveling deeper, each main bronchus branches many times into lobar bronchi and segmental bronchi as the diameters reduce sequentially. The smaller airways diverging from the bronchi into branches 3 millimeters in diameter or smaller are known as bronchioles, which branch further into a series of air sacs known as alveoli. The alveoli exchange carbon dioxide for oxygen. The lungs and chest wall are covered with a thin layer of tissue called the pleura. The cells in our lungs normally divide in a controlled fashion, replacing old cells with healthy lung tissue. However, pollutants, radiation, and other factors can disrupt a cell's genetic material, leading to cells that do not function properly and a loss of the body's ability to regulate cell growth. Uncontrolled proliferation of these defective cells results in a mass, or tumor, that damages surrounding tissues and can become cancer. If tumor cells invade surrounding tissues and spread to other areas via circulatory or lymphatic systems, the cancer is said to have metastasized. Cancer from other areas of the body may also metastasize and spread to the lungs. Some lung cancers arise from the pleura or vessels within the lung. However, the vast majority of lung cancers arise from the epithelial cells that line the bronchi and bronchioles. In addition to structural damage, cancer within the lungs commonly obstructs the airways, leading to its lethality and short lifespan prognosis. Sometimes, when the cancer is confined and has not metastasized, a section of lung or an entire lobe can be removed. Obstructive masses can also be removed, resected, from within the airways using instruments introduced through a flexible tubular instrument called a bronchoscope. However, the procedure is risky. The airway can be temporarily blocked, and when a mass is removed, smoke, debris, and bleeding can fill the lungs, causing a variety of problems and necessitating instrument removal, thus ending the procedure prematurely. Additionally, cancerous tissue residing outside the airway wall cannot be accessed, so the cancer will remain and continue to grow, eventually obstructing the airway again. Because of the historic inaccessibility of lung tumors, medical science has attempted to treat lung cancer remotely with chemotherapy and radiation. Each of these treatments has drawbacks. Traditional chemotherapy is a non-localized systemic treatment that affects the entire body and often includes a variety of well-known side effects. Radiation can be more targeted, but tumor cells typically suffer from low molecular oxygen, and oxygen must be present for radiation to work properly. Consequently, surrounding cells are often damaged more than the tumor, which may continue to grow. Sanofi's portfolio of solutions address many of the historic limitations and failure modes the interventional pulmonary science has long been encumbered by in treating patients with pulmonary disorders such as lung cancer, asthma, COPD, and cystic fibrosis.